So, welcome back. Cole Palmer news. So, Chelsea have been dealt with another setback with Cole Palmer's groin injury, keeping him out for another several weeks. According to Kieran Gill from the Daily Mail, the injury is a groin strain, but not enough for surgery. So, probably a grade two injury here, meaning a partial tear. In terms of his actual injury and the management, could you talk on why groin injuries are so complex? So why does it take so much time for him to actually come back?
Yeah, I think it comes down to a few things. Partly the anatomy. There's a lot of different muscles that attach around the hip and groin, which can kind of, first of all, complicate diagnosis. Obviously, for footballers, they'd be using MRIs and things like that, but that can kind of complicate things. And then also what that person does for rehab in
Mm.
terms of, are they doing enough strengthening stuff? Are they doing enough things that are conducive with accepting force in through that groin as they're pivoting and they're twisting? Are they doing enough return to sprinting routines and change of direction and being cleared for that? So it'd be interesting to see what his rehab looked like. But I suppose the bottom line really is sometimes these things are just tricky to manage and it's no one's fault. It's just because we're in a sport where it's very complex and dynamic as well. It can
Mm.
sometimes be tricky to measure just when this person is ready. And unfortunately for Cole, it seemed like that was the case. He wasn't quite there.
Yeah, and through stats, we know that hamstrings, calves, and groins are the most commonly injured muscles just because of how much football needs those muscles to actually perform at their best levels. So it's not surprising that it's taking a little bit of time. And groin injuries teams seem to sort of be day-to-day management anyway. However, when it's a more severe strain, it does take a little bit of time, which is what we're seeing right now. Something to also differentiate is whether it's actually a groin strain or a sports hernia, right? So, as we've sort of touched on previously, Lamine Yamal has been dealing with that as well. Could you comment on maybe the difference between the two, but also, yeah, could Cole Palmer be dealing with this, or do you think it's more so a true groin strain?
I think, like with any of these things, it's hard to say unless we get the sources. Hence,
Yeah.
your expertise, right? Whoever you're contacting is always good. But in terms of differentiating, yeah, for that sort of injury area, you're looking at really whether it's a muscle or a tendon.
Mm.
And so the tendon being the attachment point between the muscle and the bone, and how we actually transmit the forces that the muscle produces onto our skeleton, essentially. Whether it's one of those two things would be the way to differentiate it. So if it's a muscle, I do feel as if it is a bit more simple in terms of the time frames that get given, and the return to sport criteria seem to be a bit easier. Whereas for a tendon, they're a little bit more complicated and they can actually be more long term due to their structured differences between them and a muscle. So I think for him, my speculation would be that he'd be dealing more with a tendon. And that obviously then feeds into more of that sort of sports hernia or sports groin sort of scenario
Yeah.
for him, similar to Lamine Yamal.
Yep. And maybe we could also touch on why a player might be more susceptible to re-injury of the groin. Um, we see a lot of re-injured athletes like they have countless problems with their groins. Why would that be? Why is an athlete more prone to getting a groin injury, and why does it linger a little bit longer?
Yes, I think if we're talking again about a tendon injury, for example, it kind of Jude, in the research, we kind of look at it like this. It operates on a bit of a continuum, I guess. So there can be sort of different grades of overuse injuries that can occur to a tendon over time. And so depending on how far along the line you are will depend on your return to play timeline. So managing pain is one thing, which they would be very good at with all the modalities that they use in the elite setting. But actually giving that tendon the capability to be able to do what it needs to do again, and teaching your brain that it's okay to load through there is another story altogether. And so that's where it gets a lot more complicated, going to back to our point before.
Yep. And it's important to also look at where is this athlete more inadequate, right? Where if they're putting more load on one leg, if they're putting more load on the other, it is a little bit harder because footballers do use their dominant legs, right? So it is so much more susceptible to injury on one leg more likely than the other. But we can sort of use force decks and sort of equipment like that to sort of address these inadequacies as well. Um, so I guess touching on that, what can Cole Palmer, Chelsea, and I guess athletes in general do moving forward to manage these groin strains?
Yeah, so I think you touched on force decks before. I don't want to seem like I'm plugging Bout, although I am a very big fan of
Yeah.
their equipment and what they do. It can be very good to use equipment like that to determine, where an athlete is at in terms of their force expression profile, how well they're hopping, how well they're landing, their strength, their isometric strength, and getting all of those numbers to determine, as you said, some of the discrepancies that he might have around the hip and even further down the chain, to be fair.
Mhm.
And you can use those things to kind of determine what he needs in his rehab picture moving forward. And I
Mhm.
feel like for somebody like him who is quite, creative and clever and twists a lot, and that's just the sort of thing that Chelsea relies on, and he plays all the time. We need to make sure that his capacity in all these things is where it needs to be.
Yeah, good point. And it's also important for us to know that Gil, who's a Daily Mail reporter, stated that Harto's jump over Cole Palmer did not re-aggravate or aggravate it further. It is just a lingering groin strain that is going to take a little bit of time to manage. So it's good to know that he didn't get injured further. But that's all for now. Thanks for tuning in, and follow Physio Sam for more. Follow us, and we'll see you soon.
Cheers,
Later.
guys.